Hello and welcome to Girls Destined for Greatness. It's me, Dr. Deirdre, and I'm here today with Dr. Brandy Carter, and we are going to talk to you today about mental health. As you know, May is Mental Health Awareness Month, but I do want to say and remind you that every day is Mental Health Awareness Month. If you are unwell, get help. Tell someone. If your child, your daughter is unwell, talk to them. Get help. Talk to someone. So I'm going to just let us dive right into this today. So I appreciate you, Dr. Carter, for taking your time to interview with GD4G, Girls Destined for Greatness today. Let me tell you a little bit about Dr. Brandy Carter. She has worked in the field of special education for over 10 years. She started her special education journey by working for the District of Columbia Public Schools system. She transitioned to providing special ed compliance consulting for several DC charter schools. Dr. Brandy currently serves as the Assistant Executive Director of a nonprofit that serves non-traditional adult students. Over 90% of the students are identified as special education and having unique learning challenges. Dr. Brandy is passionate about making sure students with disabilities and their families are seen and heard. Her goal is to give a voice to the often voiceless. You've heard me say that before too. Dr. Brandy currently holds a BA in criminology from Virginia Union University, a Master of Public Administration from Strayer, a Master of Science in the field of marriage and family therapy from Capella University, and a PhD in counselor education and supervision from Capella University. As you can see, she's very zealous about education. And Dr. Brandy remains an adjunct professor of psychology at Anne Arundel Community College. Dr. Brandy stays true to her roots in counseling by seeing clients weekly, and she often combines mental health and education to give her students a holistic approach to learning. Her most important role and job is being a mom to her beautiful 12-year-old daughter. So thank you again and welcome to Girls Destined for Greatness.
And thank you for having me.
Awesome. So Dr. Carter, Dr. Brandy, let's just dive right into this. Explain to the GD4G audience what mental health is.
Yeah. So I like to kind of describe mental health as like your emotional, psychological, and social well-being. And we often focus on our physical health, but our mental health also is something that we most need to focus on, especially during COVID, right? A lot of times, especially during this past year, people realize that isolation can turn into anxiety. It can turn into depression. So people have really started to take a stand about their mental health well-being. So think about your emotional well-being, your psychological well-being, and your overall, just how you function is your mental health.
Okay, thank you. And then I'm wondering too, as we're getting we're starting as a society now to really recognize and acknowledge that mental health issues do exist.
Mm-hmm.
What can we do or is it possible to prevent mental health challenges?
Yeah, unfortunately, we can't prevent mental health challenges, but we can treat them and can provide treatment for them. Okay. And one of the ways to start is to remove the stigma attached to mental health. I don't want to say illness. I don't like to say illness because it's a negative stigma, but mental health challenges, or I like to call them unique gifts that we often are given to deal with, right? And so to me, the first thing is just to remove the stigma attached to it. But unfortunately, there's not a way to necessarily prevent mental health issues.
Okay. And so what are some of those things that we can do to help us? Is manage the correct word? I don't want to say manage or contain. Once we've identified some of our mental health, and maybe we should go back. What are things that are considered mental health issues, or
Yeah, and so let me start with, if you have a family history of mental health issues, let's say substance abuse, depression, anxiety, bipolar disorder, schizophrenia, you might want to be really vigilant about making sure you're checking in daily, with the practitioner, your primary care physician. If you start to notice mood changes, irritability, change in appetite, even for some who have experienced a traumatic brain injury, are susceptible to a mental health illness occurring. Another thing is if you've recently experienced a trauma, divorce, death in the family, those are things that can start to bring on like depression and anxiety. So that's kind of some of the things you want to start to look at when you start thinking about mental illness. There's some research that indicates things like bipolar disorder is genetic. The research isn't 100% concrete, but like I said, if you had that family history, you want to kind of be watchful as you progress. Yeah.
Now, I know there's been some research, and I don't know the extent to, because you talked about like certain traumatic events can bring on mental health issues. And I've heard some suggest that, say for instance, there is a death in the family, and it's very traumatic because this person is close to you, and it brings on depression, severe depression, maybe even anxieties.
Yeah.
I've heard some say that in order for that to appear, it had to have been there before. Is that what? Can you speak to that, or is that just a research? It just depends on where you stand on the pendulum of.
I think it depends on where you stand.
Okay.
Right? Because there are, I'll give you a loosely based example. You will find in adults, a lot of my adult clients, if you start to pull back the layers of why they have anxiety and depression, it's typically from a childhood trauma. Whether it was assault, whether it was bullying, whether it was a death in the family, a divorce, it's typically something that they did not deal with in childhood, that they have held on to as an adult, and it's festered into anxiety or depression. Has it always been there? Were they susceptible to it? I think it just kind of depends on the pendulum, like you said. And so it's really hard to say a definite yes or no. I'm gonna be honest with you about that one.
Okay, thank you so much. I know that just really wasn't one of the questions we talked about, but that's something that came to mind, and I did want to throw that in because we are addressing many different cultures and belief systems here today, and I just want to make sure we just address that, because in some cultures there's such a stigma attached to mental health issues, and not just one. Many cultures have their views about mental health.
Many cultures review. You think about some cultures even go as far as thinking some of the mental health challenges is possessed or is witchcraft. So it's like you said, it impacts many cultures, that stigma. So that's why I always say the first thing is to detach the stigma from mental health.
Yes. Yes. Acknowledge that something is not right. You are not well, and something is you need to get some help. Thank you. What does someone do if they are worried about their own mental health? What do I do if I'm worried about my mental health?
What I like to do is I often, if I have a new client or I'm talking to someone, I will say, start to kind of chart your behaviors, kind of do a daily mood chart to kind of identify, if your patterns are changing, if you're more irritable, loss of appetite, weight gain. And then I will say, talk to your primary care physician. Right? Let's eliminate any kind of like actual health issues first. And most of the time, your primary care physician may give you a referral to a therapist. And at that point, that's when you want to go, take that document that you've been kind of journaling about your behaviors to somebody, have a discussion, and you can start to see if there's a real, diagnosis here, or this is an underlying health issue, because it could be both, right? Loss of appetite could be a health issue, but also a mental health issue. A lot of times we don't realize that when we start to feel lazy and unorganized, a lot of those are indications of depression. And sometimes we're just thinking like, oh, I'm really just tired. I don't feel like it. A perfect example is a hoarder. They are really depressed and anxious, and it's an actual disorder, but they really physically and mentally, they don't have the energy to do anything, and it just compounds and compounds, and you have a hoarding situation. So the first thing is monitor yourself, know yourself first, and kind of monitor, am I more irritable? Loss of appetite, increase in appetite. Have I lost interest in activities? Am I no longer social? Those are the kind of things you want to watch out for.
Okay, awesome. So the key thing, talk to your primary care first. And actually you said chart how you're feeling.
Chart how you're feeling.
Behavior. Chart your behavior, changes in behavior. Then talk to your primary care about that. That's wonderful. So I'm going to stay on that, but shift just a little bit, because we know as mothers, aunts, daughters, nieces, we will see shifts as well. Before I start talking about mental health in our children and discussing that, many of us have adult parents that are older, senior parents, seasoned parents, as someone likes to say. Can you talk to us a little bit about like depression? I understand depression in seniors is very high. And what can we as caretakers, care providers for our senior parents do?
Yeah. So it's a very similar thing. You want to see, have their patterns changed behavior wise? Are they feeling less social? Are they contacting you less? Are they changes in appetite? But also, again, talk to their primary care physician, because what you want to do is rule out things like dementia, Alzheimer's, those kind of medical issues that also lead to depression. But a lot of depression in older adults, seasoned adults, comes from loss of independence. And what you can do as a caretaker is to encourage independence and create situations where your seasoned parent may not feel dependent upon you, right? And so that's one of the ways you kind of help them cope with feelings of just losing their independence, and also isolation during COVID. That was a leading factor to depression in some older adults.
Okay, thank you. So now I do want to shift, because I just thought it was very important to talk really quickly about our seniors. And I feel funny saying seniors because I'm like, ooh, I'm getting closer. That's why the more seasoned
adults.
Yes, but I do want to talk now as shifting into mothers and daughters and aunts with their nieces, grandmothers. There are lots of grandparents raising their granddaughters now. They're just different family interactions. And I want to talk about, research says there are really 5 mental health challenges that our young students face in school: depression, anxiety, suicide, addiction, eating disorders. And so what should parents be looking for? A lot of times parents, they stay and stray away, I notice as an educator, from asking their kids a lot of questions, giving their space. So what should parents be doing? What should they be looking for? What questions should they ask? Where do they get help?
I like to start. Is there a drastic change in grades? Is there a drastic change in behavior? Is there a drastic change in socialization? And I always think, start with the teacher. And most times the teacher may even contact the parent and say, hey, I noticed Johnny isn't as active in class. He doesn't participate as much. They usually will say, is anything going on at home? And that's your kind of way to say, well, I noticed the same thing. Now I was going to contact you. What have you noticed? And then maybe have a conversation with the school counselor and encourage your child. Hey, if anything is going on that you want to talk about, your school counselor is available. I'm available. That's kind of a place to start. But again, as educators, we always want to rule out that it's not an academic issue before we start looking at, is it a mental health issue? Because another issue that impacts scholars is ADHD. that sometimes goes misdiagnosed or, ignored. So we want to kind of rule all of those things out and then start to say, what are you feeling? How are you feeling? Have you experienced these feelings before? Any feelings of suicidal ideations, self-harm, kind of be, like you want to give them your space, but be watchful if you notice any signs of self-harming. If it's the summertime, it's your child maybe wearing long sleeves, long pants, and that's not usual behavior for them. You want to give them their privacy, but also giving them their privacy, you let them know that you have an open door policy for communication. So if anything is bothering you, let me know. And if you don't feel like you can talk to me, let me find someone to help you. Let me find someone you can feel comfortable talking to. So those are the kind of things you want to really watch out for, and no longer enjoying the activities they once liked. And if you can, monitor the phone usage and the technology usage, because that can be all consuming for younger people too. And you want to kind of make sure they're not watching things that encourage suicidal ideations and self-harm, because there were things a couple of years ago where someone was having like a suicide challenge. And it's strange to us, but it happens. Right. Just kind of be mindful of what they're into, and encourage them, what are you into now? What kind of music try to get, more involved into what they're doing. And I know my daughter thinks I'm so uncool, and I'm like, what's up? What are you looking, where your friends at, but I'm just trying to stay tapped in. And I keep a really open line of communication with her school counselor and her teachers.
Right. Yeah. So, and it's key, and you said staying tapped in as a parent, staying tapped in. I'm going to address the educators real quick in a minute, but for parents, it's like, well, the teacher never told me, or how did I miss this? And I think, and I'm not being hard on parents at all, but sometimes we miss the obvious because we don't, and I say we, I'm not a parent, I'm an aunt and a mother to many, kind of thing, but we miss things because we don't ask questions. We want to give them that sense of privacy. And so I'll say my niece and I are very close, and she's an adult though. She's an adult now. She's a teacher, but I'll ask a question, and that, why do you want to know? Attitude. And so I know I've touched a point, and it may not be because there's something that's wrong, right? But I'm going to push and poke and be like, so why are you upset about that? Yeah. Why did that push a nerve for you? And so I think as parents, they need to understand not to be scared to push the button because they're scared their child will shut down. The shutdown is sometimes a sign that you need to take action. And maybe, and you're a parent, and do you agree? I know you have a very close relationship with your daughter, but for those parents who are like, I want to give space, I want to give respect, if you can't talk to them, you need to be talking to someone else who can talk to them. Yeah,
I think it's important. So there's two things. I think when especially with young girls, it's hormones. Don't always confuse it for hormones. Just do some temperature checks, because it can be hormones, right. But let's not always make that the default. And I also think you have to normalize communication. Sometimes communication is not comfortable as a parent because some things you don't want to hear, but you have to show them that you are you're open to those kind of conversations because it makes them more comfortable, right? And so I try to communicate just a little differently than my mom did with me. And my mom's old school, so it's there's some boundaries there, but I try to be as open as possible. Let her know that, me and your dad are super accepting of things. We're cool. She hates when I say that, but I let her know, like, this is an open door policy. But if you ever feel like you can't, right, like, you have a therapist to talk to, you go to, and you use that as your safe space to communicate. Okay. I just say just normalizing communication is a big thing for our youth.
Oh, absolutely. Yeah. Especially with now technology. We don't have to have that whole face-to-face, and sometimes knowing how to have, people texting their kids, are you going to come eat, or the food's ready? Yeah. When I don't understand. I don't know anything about that. But, but just that's so important. And then to teachers, I do want to say, sometimes we are the first line.
Yeah.
that kids, and it's so important. And now, like, I teach my students that when you go into a classroom, academics are important, but that relationship
Mm-hmm.
and building that safety is so key.
Yeah.
It is so key. And if you notice something about a student that's off, that's different, everyone has a bad day.
Yeah.
And don't equate someone not making 100 on a test, who usually makes 100, to
Mm-hmm.
something's wrong. It may be that one time, but if it's a pattern, don't be scared. We are obligated as educators to address
Mm-hmm.
those issues and to seek help. So if we notice drastic changes, we need to say something. If the communication starts with the student and then moves to, the parent conference, and then, okay, something's off with that, we need to take the necessary steps and measures to make sure that our children are getting the help
Yeah.
that they need.
Even as educators, the first thing, you want, especially with younger kids, hygiene.
Mm-hmm.
How are they coming to school? Or do they, just some things you want to just kind of key on, do they come to school, disheveled?
Mm-hmm.
Do they seem very frightened, fragile? And I know those are kind of really tough things to even consider, but home life isn't always the greatest for children, right? And so as educators, like you said, those frontline workers are noticing, like, noticing some things going on, Johnny. Maybe I need to bring the school counselor in, or have a conversation with mom. If that doesn't feel right, then there are steps you can take. But I agree, educators are tasked with sometimes being the frontline person with noticing things when it comes to younger children.
Right, yeah. True. So as we kind of wrap up here, it's important for all of us, those of us, if we have children, we're around children, we teach children, work with children, we need to just pay attention and be aware.
Yeah.
I always say I am, and keeping it GD4G real. I can't stand people who don't protect children.
Yeah.
That is one of the things that I just have a major problem with.
You're most vulnerable.
Grown-ups are to protect children. And when we stop protecting children, we are not doing our jobs in developing healthy and well and protected adults. And we create a society of chaos and confusion. And we see a lot of that happening. So we have to protect our children. And I will say, my mom, hopefully I can do a mom moment with my mother. And come on, my mom talked to me about everything. Any question that I had, she had an open door policy. And she still does. And now I'm an adult and she's asking me questions. I'm like, yeah, that's a line, Mom. You don't have to cross anymore. Right, because that's the relationship that we have, that she feels comfortable saying. And that is the relationship that, I have with my niece and even my nephew, that they can say, I can ask them a question and they might be like, oh, we're adults. But the fact that they will give me an answer is important. And if they are not feeling well, they can know that it's okay to go talk to a therapist.
Absolutely.
Or it's okay for me to call you and have that conversation because I know it's safe. You're not going to tell me to get over it.
Yes, that's a
whole nother.
Yeah, that's a whole, I was going to say, that's the biggest fear of somebody saying, you'll be all right, get over it.
Yes.
It's not always that easy.
That's not how that works.
Yeah.
Okay. So any final thoughts as we close out, Dr. Brandy?
Yeah, just, your mental health is just as important as your physical health. And understand that stress and anxiety tends to manifest itself physically. So that's one thing you always want to remember. And, shop around for a therapist just like you would for a car, for a house. Psychology Today is a great website where a lot of therapists post their bios, their specialties, and all those things. But don't feel bad about going to a therapist. If you don't get a good vibe, you have the right to, it's okay, right? Because you want it to be a good experience because it's a safe space and it's a place for you to be vulnerable. So you want that connection to be there. So I always encourage people, shop around for a good therapist as if you would do for any other big purchase in your life. So mental health matters.
Yes, it
Like
does.
I said, remove the stigma. Don't be scared to ask for help.
Awesome. Thank you so much for your time in interviewing today with me, with Girls Destined for Greatness. There will be some links or some information at the end of this video for you if you or someone you know might need some mental health support, or if you have further questions, feel free to reach out to Dr. Brandy.
Yep.
Her information will also be in that last slide there. So again, thank you so much, Dr. Brandy, for interviewing with us at Girls Destined for Greatness for Mental Health Awareness Month. And thank you to all you wonderful and fabulous GD4Gs out there. This is Dr. Deirdre. Have a great, wonderful rest of your day.